For I was hungry, and you gave me food. I was thirsty, and you gave me drink. I was a stranger, and you took me in. I was naked, and you clothed me. I was sick, and you visited me. I was in prison, and you came to me. These are the words recorded in Matthew 25, verse 35 to 36. It is for this reason that the Rivers of Living Water mission has been following God's command by producing believers in Christ who would build people first through the message of the cross of Christ, so as to become mission-minded. Therefore, to actualize its vision, the Rivers of Living Water missions have been making donations of medication and micronutrients to children and expectant mothers.
We are a missional church called Rivers of Living Water Mission, an organization that is registered under the Societies Act of the Laws of Zambia. Since 2019, we've endeavored to support the community where we do the work of God in a number of ways. The Provincial Health Director, our primary intent and purpose are to share the love of God through mitigation of individual demands. We distribute Bibles and biblical literature, foodstuffs, clothing, economical assistance, and medical supplies in our community, regardless of race, gender, color, political connection, or social status in society.
We started this program by embarking on an ambitious project to alleviate micronutrient deficiency in infants and pregnant mothers in Deke Village, Kitwe.
Rivers of Living Water Missions, in collaboration with Vitamin Angels from the United States of America, an organization that works as a public health non-profit, supports this humanitarian cause for the people of Zambia.
We began this program with an ambitious project to address micronutrient sufficiency in infants in Deke Village through Deke Village Hospital in Kitwe. We've been doing this since 2020 in collaboration with Vitamin Angels, our US-based cooperating partner. We began planning to expand our micronutrient supplement to the most rural areas of the country in 2021, and this plan was shared with our cooperating partner. Lokra province was the most popular of the provinces we suggested for the pilot project based on its nutrition landscape, which was graciously shared by your office. Therefore, we work to supplement government's efforts in addressing micronutrient deficiencies among the under 5 population and expectant women in your province. Sir, on behalf of Rivers of Living Water Missions and Vitamin Angels, and indeed on my behalf, we would like to donate the listed supplies below. 52 bottles of albendazole will benefit 26,000 children aged between 12 to 59 months. The second one, 104 bottles of vitamin A with a strength of 200,000 IU will benefit 26,000 children aged between 12 to 59 months. Third, 51 bottles of vitamin A with a strength of 100,000 IU will benefit 12,750 children aged between 6 to 11 months. Last but not least, 189 bottles of multiple micronutrients MMS will benefit 4,725 expectant mothers. The total number of beneficiaries is 38,750 under 5 children and 4,725 expectant mothers. So the total value of the donated item is equivalent to 240,492.
Micronutrients and trace elements have an important influence on the health of both the mother and the fetus. Deficiency of micronutrients during pregnancy may give rise to complications such as anemia and hypertension, as well as impairing fetal function development, and growth of the filters.
I'm deeply honored to preside over this handover of the micronutrients on behalf of the Ministry of Health in Zambia Province. We are very grateful to Rivers of Living Water Mission for the gesture, and I must mention that this donation is logically timely, considering that our nutrition situation here in Zambia Province is of public health concern. We have high malnutrition in all its forms, including micronutrient deficiencies among women and children. According to the 2018 Zambia Demographic Health Survey, micronutrient deficiencies are a concern in the country and particularly in Zambia Province. This calls for accelerated implementation of high-impact intervention through continuum of care within the healthcare system. The Ministry of Health has therefore placed micronutrient supplementation on its top priority list. That is more reason we supplement iron and folic acid routinely among pregnant women to prevent iron deficiency anemia. We also supplement vitamin A for children aged between 6 to 59 months in order to prevent all forms of micronutrients and enhance child health and survival. The donated supplies which I will be receiving on behalf of the province include 104 bottles of vitamin A, which will benefit 26,000 children aged between 4 to 59 months, 52 bottles of albendazole, which will benefit 26,000 children between the ages of 12 to 59 months, 51 bottles of vitamin A, which will benefit 12,750 children aged between 6 to 12 months. These items will be channeled and integrated in the health system care supply chain in districts and health institutions where the need is higher and critically important. I'm convinced that these items will go a long way in supplementing government's efforts to raise the nutrition status of our children to optimal levels. As I conclude, I wish to reiterate government's gratitude to Rivers of Living Water Mission and other partners in nutrition for partnering with government in running with the agenda to redress the nutrition status in the province. May I end by saying thank you everyone and God bless you all.
That are being donated. So at this point in time, sir, I call upon you.
More donors are willing to donate various medicines and health equipments to Zambia, provided that the Rivers of Living Water missions cater for the shipping costs and logistics. We are therefore calling for more support regarding the aforementioned to be able to help more Zambians in the country.
We would like to emphasize that it is our sincere hope that our collaboration with the Ministry of Health through your office, sir, will be ongoing rather than one time. Sir, I would like to inform you that we'll soon be linked to UK donors who want to donate pallets of medical supplies, PPE, on condition that our organization pays for shipping and clearance. In view of the above, we will welcome collaboration from you, sir, and any well-wishers to ensure that our medical personnel from hospitals or clinics are fully protected from germs, viruses, or communicable diseases. Once again, sir, thank you for honoring this occasion with cooperating partners and your staff. May God bless you.